Morning or good afternoon. My name is Jinan Fiadi. I'm from Lakehead University, Ontario, Canada. And I would like to thank Professor Taihun for his nice invitation to this international conference on cutting-edge research, which will be July 1st to 3rd, 2022. More introduction to myself. I'm the chair of the Special Interest Group on Big Data for eHealth with IEEE ComSoc. Also, I'm the graduate coordinator for the Biotechnology PhD program. And I do research on collaborative learning, thick data, and AI for the last more than 10 years. The presentation or the research that I'm going to present for today is under the title of Endoscopic Clinical Diagnosis using Thick Data Analysis. Also, one of my collaborators, beside Dr. Sabah Mohammed, the other collaborator is Dr. Petros Zizos. He's a medical doctor in Thunder Bay Regional Health Science Center. This research is in collaboration with both of them. And in this research, the research has been ignited by a lot of physicians' requests, like Dr. Zizos, in order to reduce their workload, as they are burned viewing multi-thousands of video frames after each endoscopic intervention. Identifying a colon problem like ulcerative colitis requires a lot of focus to find the ulcerative inflammation areas at the colon. The issue that we cannot ignore ulcerative colitis identification accurately because of the complications of this condition can be devastating, including, for example, severe bleeding, rapidly swelling colon, increased risk of colon cancer, bone loss, and so on. So the management of this disease, the UC, is depending on its severity. So the main objective is to measure the severity of the UC or ulcerative colitis, which in turn is based on the severity of the clinical symptoms, mainly the frequency and severity of bloody diarrhea and the severity of the endoscopic finding, including edema and ulceration. So knowing the severity of the UC will let the physician to specify the type of the treatment, like medication if the patient is in need to it, or the patient needs to go under a surgical management. That can be done only through endoscopic examination in order to know the severity of the disease. So the question or the research objective that we are going to talk about and try to solve it is, how do we measure the score of the severity? The score of the severity, there are different types of scores. There is a score which is 0. It means that the patient does not have any critical symptoms. The score, if it is 1, which is the most, reflects some other type of symptoms. But and there are actually many controversial methods, including a Mayo Clinic endoscopy score, which is MES. This one is the most commonly used in clinical practice as well as in clinical trials. Beside others, like for example, Baron score, beside Max score, Blackstone index, and so on. So even if we ignore other techniques and focus only on the Mayo Clinic endoscopy score, still we will need to understand how can we do scoring automatically based on AI and ML, because looking at the frames by the physician, definitely he will be able to say what's the type of the ulcerative colitis. But our problem is how to do it when we are using definitely automatic solution based on the artificial intelligence and machine learning. As I mentioned, the scores are different. For example, this is 0, which means normal. This is 1, it means the disease is mild. And then this is 2, which is there are some other symptoms. And the most one, which is the Mayo Clinic endoscopy score, which is 3, it means it is severe disease, i.e. there is bleeding and diffuse ulceration. So this figure illustrates the grades of the Mayo Clinic endoscopy severity in colon images. But for the endoscopy, there are different forms for the endoscopy. When we are coming to use the endoscopy, there is optical endoscopy, there is virtual endoscopy, there is colon capsule endoscopy, which is considered as the golden standard for detecting various colon anomalies, including, like, for example, polyps like this one, ulceration colitis, and colorectal cancer. Also, it has been definitely recommended as a regular screening test for a group of patients who encounter no symptoms related to their colon for early detection and prevention of cancer, as many anomalies like those polyps are likely to develop cancer later on. However, those different type of colonoscopy is providing actually very large number of frames, like for example this one 10,000 and 50,000, which is very difficult for the specialist to detect different type or give a score for the ulcerative colitis. Also, research shows that the UC severity scoring accuracy actually depends on the experience of the examining physician or on the type of colonoscopy device used. For example, there is high definition and there is normal definition videos. So, however, even if we increase the definition or high definition colonoscopy devices, still the improvement is marginal. In order to minimize the effect of physician experience, most of the research body currently is pointing to the importance of using more computer-aided software, including artificial intelligence, machine learning, for validating the endoscopic assessment of UC, as well as for predicting patterns that may be missed by the evaluator. So using in this direction, we use deep learning convolutional neural network, which has made significant success in the area of medical image analysis, and in particular in the area of colonoscopy, mainly identifying polyps with high accuracy but not UC, ulcerative colitis. So, and moreover, neural network in general are sensitive to the availability of large representative training sample. But when there is no large training sample, here it comes the problem. That's why machine learning, including deep learning, cannot effectively result in reliable and robust accuracy in classifying medical images unless the neural nets is trained on extremely large annotated sample, which is the big data. But with many medical practices like the inflammatory bowel disease, the annotated training data is relatively small, requiring more additive techniques to predict important indicators like identifying acute ulcerative colitis region of interest. So what do we need? We need actually in the medical world not only the quantitative approach based on machine learning and big data, we will need other techniques like in here the physical heuristic, the qualitative techniques, and we need to use the explainable artificial intelligence, XAI, approach to provide clues to the reasoning of the deep learning convolutional neural network and on why specific frames have been segmented with particular score of ulcerative colitis. So we need explanation, not only to measure the score. And this is a paper which I presented in an article which is presented in the IEEE Big Data 2022 on using thick data for rating UC based on small samples. Now, although thick data filters will help the neural network to achieve higher accuracy, but remain short and provide explanation on the way these neural net may achieve their decision. So in this direction, we actually used 3 heuristic injection method to be augmented to the neural net, designed to provide some level of explanation or explainability, including adding the rationalizing techniques, improving semantic association, and as well as generating visual explanations such as captioning. So this figure actually illustrates those 3 suggested neural network, and in this direction we are going to investigate how adding captioning heuristic may enhance the explainability of deep learning model used for the ulcerative colitis scoring. In this direction, this is the model which you are seeing in here. It uses few images sampled to classify frames using the Siamese neural network. This model then passes the categories as generated by the Siamese to train the LSTM model, which will generate suggested description and caption to the originally provided video. This is more details representing the explainable thick data video colonoscopy. The data set that we used in this direction is taken from Norway and has been annotated by experts. Also, the Siamese neural network definitely is a kind of neural network that can learn from one shot or few shots. It's generally actually useful for learning when no training sample is available, as the legacy convolutional neural network will not be able to learn the features required with the given small amount of data. I did already explain the Siamese neural network. So this is again what we needed in the Siamese neural network is to take the we used actually a triple ranking loss algorithm. Triple ranking loss algorithm it helps in giving explanation, which we actually took an anchor and compare it with the positive image and negative image. And this is the data set. This is the code that we used in order to find the explainable score for the ulcerative colitis. And in this way, we decided to use the TensorFlow and Keras deep learning API. And we continued the process. This is the Siamese neural network, is a sequential one actually that has this structure that you are seeing in here. And those we use different layers, which is followed by the computing the induced distance matrix between each Siamese with the frames. And those are more details about the implementation and the accuracy that we reached. And then as a conclusion, the prediction accuracy actually was around 70%. And as a conclusion, this is the way we treated how to reach the score of the ulcerative colitis using machine learning and AI. We reached a good amount of prediction, but we are continuing to work on improving the accuracy. and thank you in listening, and if you have any more questions, so thank you.